I wanted to share some conversations that I have with patients that made me appreciate life, appreciate health, ganyan. I was listening to a Sunday Mass last week, from Father Joel, or maybe 2 weeks ago. Sabi niya, there are 3 places na we have to visit for us to appreciate life: a cemetery, prison, and hospital. I would like to share yung experience ko sa hospital in a health point of view, sharing some stories that I had with patients, ganyan. Kasi it can really be depressing most of the time, and there's no amount of diploma, of graduating with honors that can prepare you to talk or to help people, especially when they are sick. Kasi more than the nursing skills na we learn sa school, empathy is one of those skills that we develop over time through experience, through practice. They always say na iba yung theory, iba yung practice. So, even though kabisado mo na yung routine, kung ano yung mga gagawin mo, for example, preparing a patient for a diagnostic procedure, pero sobrang dami niya ng worry, hindi siya mapakalma, ang angsty siya, ganyan, you still have to address those first before ka mag-proceed sa procedure. And we have to communicate with them in a human-to-human connection. A doctor being a patient. So I had a patient who is a doctor. As I'm preparing him for the procedure, ganyan, kausap ko siya. He told me that for 40 years na nag-work siya sa practice, he was really working hard, and all of a sudden, he has to send himself to an emergency room kasi he was feeling xoxo sa bruise perais niya. So his heart needs to be checked. The news is definitely shocking kasi for someone working in a medical field, maybe you're a doctor, maybe you're a nurse, no one is immune not to develop a disease. That physical changes that normally happen sa body natin as we age, yung metabolism natin nagsuslow down, andyan din yung sakit-sakit na, the things that we experience na gives us stress, and of course, the fact na our work is really demanding. Imagine having those irregular schedule. For doctors, for example, they can go on duty for 72 hours. As a nurse, you go on Frühdienst, Spätschicht, tas Nightdienst, and then sometimes you would also have on-call, mga Rufbereitschaftsdienst, ganyan. Dagdagan mo pa yung workload, lalo na pag may emergency. And the effect of stress in our body, especially if it's chronic na, lahat tayo pwedeng magkasakit. Now, the health teachings that we tell our patients, get enough sleep, eat healthy, do your exercise, drink water, manage your stress, do your self-care, prioritize healthcare, prioritize your mental health, should be a conversation that we also have to tell ourselves. But the truth is, sometimes, most of the time, we do neglect to acknowledge that. Combining now what I know about spirituality, about health, our body's way to communicate with us is through pain, through symptoms. Our cells won't shout to us na, girl, ayokong kumain ka ng matabang baboy na yan, or girl, wag mo po akong stress, or girl, mag-exercise tayo this week, girl, mag-healthy living na tayo. I hope we can learn to be connected with our own bodies so we'd be able to listen if something is no longer right, so that we won't just ignore those warning signs before pa lumala. Stress over time can also lead to illness. May we recognize it too. Quit smoking, drugs, and alcohol. We know it. Everyone's know it. Pero YOLO lang tayo kasi girl, once lang tayo mabuhay. What is life naman if we cannot enjoy it? Sabi nga ni Father Joel, don't pray for a long life, but rather pray for a healthy life. Last week, one of my patients too, we need to do PTA, that's percutaneous transluminal angioplasty. Ito is narcotic na, maitim na. Tapos naka-high dose na din siya ng BTM. Pero sobrang sakit pa din daw, hindi na nag-e-effect yung mga pain medication na binibigay sa kanya ng doktor. So ayun, piniprepare ko siya, ganyan. I was explaining the procedure, and then I have to put all of her belongings dun sa shrunk namin. And then namoy ko na nag-iossi siya. So after the procedure, lapit ako sa kanya kasi under monitoring pa din siya, tapos lumapit din yung doktor, ganyan. And the doctor told her about the findings. So the conversation that they had is, sabi ng doktor, I cannot give you lots of hope kasi it's wrong naman to do that. But the only Möglichkeiten, the only possibility that we can do is to amputate your legs because hindi na nakaka-flow yung blood papunta dun sa feet niya kasi block na yung artery niya sa unterschenkel cervical area pa lang. I was standing there and I also have no words. The only thing that I was able to utter around that time nung umalis na yung doktor is, I'm sorry to hear about the news. So again, may you also look in your lifestyle too, no? Drugs, smoking, alcohol would never do anything good sa body natin. Papahirapan lang natin yung sarili natin. And then you say YOLO. A lola who got into cardioversion. Cardioversion is kukuryentehin yung puso around 200 joules para ma-bring back ulit yung regular rhythm. So I assisted one of my colleagues. I told you no na I'm in training, so we have a patient who is lola. Sobrang dal-dal. Tapos, her heart rate is around 120 to 140 beats per minute. So, sobrang taas. Si Lola, sobrang daldal talaga. Lahat ata ng topic na pag-usapan na ganyan. And then, nung umalis yung colleague ko, no, para tawagin yung doktor, sabi niya sa akin, isyabang. So, ayun, usap kami ganyan. I realized, no, most of the time, pag yung sobrang daldal ng tao, sobrang loud, mahagalitin, ganyan, may dinaramdam yan. And they sometimes mask it by being too loud, pero sa totoo, there's that fear, andun yung takot. So we put her into sedative kasi she has to sleep during the procedure. And the doctor did 2 rounds. And the heart was unresponsive dun sa treatment. On the recovery room, no, I talked to her again. Mangiyak-ngiyak siya, tiri, ganyan. She told me, no, na it didn't work as we hoped for, pero weiterleben lang daw siya. Move forward na lang. And I appreciate those conversations, no, na move forward na lang. Kasi madalas, there are also some things na we cannot control. Sabi niya, papahingahin niya na lang muna yung heart niya, magmedikamente muna siya, and then after a few months, she'll decide if gusto niyang mag-cardioversion ulit. And so I said, si Schaffentasyon. So may these conversations, kumbaga, give you that kind of appreciation about our life, about our health, our body, kasi it's a totally different story pag andun na din tayo sa situation nila. I know it's kind of heavy. I appreciate your time today. This has been Odyssey, and I'll see you in the next. Cheers!